Welcome to the Health Show. My name is Sal DeBella and I'm your host. Today we're going to continue our series of interviews with veterinarians. So far it's been very interesting. So today our guest is Dr. Michel Selmer. He is an integrated veterinarian with a veterinarian hospital in Long Island, New York. He's known online and is known online for his approach and being with his clients for the best of both worlds. The conventional or standard approach to veterinary care, as well as the alternative approach, including acupuncture, herbal remedies, and more. He soon has a book he's going to release, The Dog Patient. It's a guide to integrated veterinarian care and will equip dog parents to make more empowering and educational approaches to their puppy's care, no matter where they live. So welcome, Dr. Selmer.
Thanks for having me, Sal. It's great to be here with you.
Thank you. So we have a lot of questions. So we're going to start right away with the questions. Firstly, if you can give our viewers a little bit about your background and your credentials.
Okay, so I graduated from traditional veterinary college or Western school in 1995 from Michigan State College of Veterinary Medicine, and went along my practice for years as a mainstream veterinarian, treating dogs and cats for common ailments, cancer, allergies, vomiting and diarrhea, that itchy dog, the smelly dog, all of those fun things that we see. And, I found that sometimes I would get to a point where I only had so much in my tool chest to use, and how saddening it was when I'd have to put my hand on a client's shoulder and almost say to them, there's not much more I have for you. Well, when I was much younger, I was diagnosed with a disease called Crohn's disease. And that's an inflammatory disease of the bowel. And there's some treatments that are being given, and they're aimed at symptoms. And I had some trouble understanding why I could only manage the symptoms of the disease and not get to the root cause of it. So I started to teach myself exercise physiology and naturopathy, and I started to complement my treatment with those modalities. And I found in the last 5 years that they can no longer find Crohn's disease on biopsy. So it led me to believe that there must be other avenues or philosophies that we can employ for treatment. So I decided to start implementing naturopathy in my patients and changing pets through their nutrition. And then that led me to getting certified in veterinary acupuncture, which then led me to getting certified as a food therapist, and then to an herbalist, and finally to a specialist in Tui Na, which is Chinese massage. So I'm soon to be labeled as a master practitioner in Chinese traditional medicine, as well as a licensed veterinarian.
Okay, that sounds good. Now, can you tell our viewers basically when a patient comes to your hospital, you have a hospital, right?
Mm.
And that's in Huntington, New York, is that right?
Yes, okay. In Huntington Station, New York.
Okay. Now, when they come there, what can they expect? In other words, do they come for examinations once a year and things like that?
Well, people come to me for, wellness evaluation and to help maintain health of their pet, as well as when they have problems with their pet. Many times people come to me as a second or third opinion because they're really not getting the answers that they expect to get. And again, they run up against this wall of, how much can the doctors do for their pets in the situations they're in. What they can get from me, rather than going to a traditional veterinarian, is we're going to treat the animal as a whole. And that's really where the true word holistic comes from. And to be truly holistic, not only do you have to look at the animal as a whole, but you have to look at medicine as a whole and try to employ as many of the philosophies as you can, because each have strengths and weaknesses. And if you combine those worlds, the best of East and West, you can use the strengths and weaknesses of each and build a better plan for management of good health in their pets.
Okay, so now when they come to you, they get blood tests, do they get x-rays? I mean, for a regular physical exam, a once a year physical exam, what do they get? What, blood tests, I would imagine?
Right, so we use the strengths of both Eastern and Western medicine. So Western medicine, one of the biggest strengths we have is diagnostics. So we absolutely implore our clients to allow us to do diagnostic testing on their pets. When you look at a dog or a cat, it's the equivalent to treating a mute in a person, right? So the animal can't speak to us. So we rely very heavily on not only diagnostic testing, but we also rely very heavily on the owner. And the owner, in my opinion, is an extension of my healthcare team. So they become my nurse. So not only do I use the Western diagnostics to help get a handle of the health status of the animal, but then I use Chinese medicine and the physical exam and use all of my senses, the sense of smell, the sense of touch, the sense of vision, to help get more data to implement in developing a diagnostic and treatment plan to move forward. See, unfortunately, when you go to the doctor these days, a lot of times our doctors rarely touch us. They do testing and they read reports, and I question, are they treating the report or are they treating the patient? And using the advantages of going back to basics, using medicine as an art, and using our senses and our intuitions as doctors allows us to be true healthcare providers.
Okay. Now, at what age does a cat or a dog develop a disease? Could it be a young age, like cancer, heart disease, arthritis?
So there are diseases that you can get very young, which are congenital, right? So you can get seizure disorders at a very young age. Unfortunately, there are many children in hospitals even today that get cancer at a very young age. And you can get diseases as you get older. One of the strengths of Western medicine is to treat the acute diseases, right? Those emergencies that come in where you need interventional care. So if you have a blockage in a coronary artery in the heart, we can put a stent in that artery and save a life. If you break your leg, we can set that bone and heal it, right? And that's a big strength of Western medicine. In Eastern medicine, well, Chinese herbs and acupuncture aren't really going to help much if you fracture your leg. And if you have a blockage in a heart artery, well, it's not going to work fast enough to really help relieve that blockage. But it does help in the degenerative diseases. So cancer is a very interesting discussion because when I look at cancer, I believe that we get cancer from many, many different inputs in the world as well as what we put in our body, right? So diet can be an influence. Our genetics can be an influence. But if you break it down to like the simplest layman's terms that I can, if you have chronic inflammation and a weakened immune system, it's going to lead to cancer. Your body is continually reproducing cells and making new copies. When your immune system is healthy, your immune system will pick up those abnormal cells and destroy them. When your immune system weakens, it has lost the ability to do an efficient job of picking up those abnormal cells, and then poof, you have a tumor somewhere, right? So that can happen at any time depending on the stresses and the nutritional status of the body and how well it's kept to perform optimally.
Okay. Now, you also, dogs and cats also get parasites, they get worms. And how do you treat that?
Well, another strength of Western medicine is a big anti-philosophy, right? We have antibiotics, antiparasitics, antivirals. It's really an anti, whereas Chinese medicine is a tonifying philosophy, where we build things up. There's not many things in Western medicine where we're building up, except in diseases where there's hormone deficiencies and we're replacing hormones. So when you have a parasite, isn't it great to be able to pick a product that you have good predictive value that's going to kill that parasite? So Western medicine gives us that avenue. If we have a headache, I can tell you with good predictive value, if you take an anti-inflammatory like Aleve or Advil or Motrin, that your headache is going to feel better, right?
Yeah.
If I give you an herbal remedy for your headache, I can't give you the predictive value. What I can tell you is, for most people over the years, this seems to have worked. So, in my opinion, if I had a patient that had a parasite, why wouldn't I want to use the targeted treatment that I'm going to be sure to kill that bug and rid the dog of that parasite? So I would reach for that Western drug in that case.
Okay. Now, as far as other things that humans get, like cholesterol, how do you treat cholesterol, or do you check for cholesterol?
Well, we do check cholesterol levels, but it has a different meaning in veterinary medicine than in human medicine. Dogs don't get coronary artery disease in the same way people do. And they also don't have the longevity of life that leads to the artery blockages and sclerosis that we as humans get later in life. Cholesterol is more of an indicator of other diseases like Cushing's disease, for example. So in a way, the only way you're going to be able to monitor those blood levels is by doing the appropriate blood tests. So we do those routinely on dogs that are, under 6 years old. We recommend doing those blood tests and urine testing once a year. In dogs that are over 6 years old, we typically recommend getting that dog screened twice a year.
Okay. Now, who develops, cats or dogs, who develops cancer at a higher rate?
25% of all animals and humans will get cancer, no.
Okay.
1 in 4 will get it. I really think that's a good generalization regardless of species. So if you're in a room with 4 people having dinner, one person at that table is going to one day develop some sort of cancer. And we see that in our animal friends as well.
I said on another show, which is amazing, which I think helps animals to develop cancer. Here in Boston, and mostly all Massachusetts, they say that there's like 69 chemicals in the water. And just recently they came out with something else that's in 52 states that causes cancer also. That's in our water. So in the people that I've met and known that had animals, they go and they get tap water and they give it to the animals, where on the other hand they drink bottled water to protect themselves from these chemicals. So do you have an opinion on that?
Yeah, I think the more filtered the product of water is that we can get, the healthier it will tend to be. Now, again, I believe that everything's been put on this planet for a reason, to support life. And whatever being that may have been that placed it here, it's all here for a reason. And I believe that all the answers to all our problems are here as well. We just need to find them. So if I was going to recommend the water source, I would recommend the same water source that I would give to my children, as well as to myself, as well as to my pets, my dogs or cats, because they're my children too. And I would want a natural source of water, or the most natural that I could get. Mm-hmm. So natural spring water would be really a great option. Unfortunately, we live in a world where things are not so pure, and we have to be realistic about what happens around us. So now let's say, for argument's sake, we have water that even we bought that may be bottled, but for some reason there may be contaminants in it that are carcinogenic. Well, I think my job as a healthcare provider is to make sure that that animal's health and organ systems are performing optimally to handle the insult, so that it doesn't lead, or at least leads to that problem later in life. So you have to think about what happens when you ingest those toxins. Well, the liver has to metabolize them, right? Well, we need to keep that liver healthy. And what's the best way to keep that liver healthy? First step is wholesome nutritional feeding. For those people who have been convinced that dog food, kibbled processed food, is the answer for their dog, I challenge them and say, if you had a child, would you feed it one specific type of breakfast cereal for every meal for every year of that child's life? And then would you say that's a healthy diet? I don't know any person that would agree that that would be true. So the first thing we need to do is change what our pets are eating to make their bodies perform better and optimally so that they can handle these toxic events that they're exposed to. And the best way to start that is with wholesome nutrition. But they need to be really careful because they need an expert that's trained to help them formulate a balanced diet that will work. See, a lot of people think it's great. I'm going to go out and I'm going to start cooking for my pet. Well, that's super, right? I want everyone to do that. But you need to know how.
Mm-hmm.
So you need to find that professional that's certified as a food therapist so that they can help you make the proper food choices and then put them together in a proper way to create a balanced diet that's appropriate for that specific animal.
Mm-hmm. Okay. You know, myself, what I've started maybe years ago when I started to get into interviewing doctors, and I've been doing this for a long time, I found myself for my own health, I will not, and I heard Dr. Oz say this also, I will not put chemicals in my body of any kind. Last year, the year before, as far as Medicare for me, they send you a letter of what prescription drugs you took. I took nothing. I took nothing. I try and I go to Google or I try and find out what is the best thing that I can do not to take this drug. Because you take this drug, it's a chemical, you know, it might solve one problem, it might give you another problem. People should listen to the TV commercials and what you could get. And this is why I stopped doing that. But getting back to dogs and cats, a lot of owners spray, like tick spray and all kinds of chemicals on the dogs also. And besides that, their lawns are sprayed with chemical, and the dogs or cats are low to the ground there, you know, pick up toys or whatever from the ground. So all of that, in my opinion, I think might be a bad thing. What do you think?
Well, I want to go back and address your first concern about, you know, how to get good answers, right? Mm-hmm. And I do agree with you that, you know, there are a lot of things out there that can cause some good, but also can cause a lot of bad, right? Mm-hmm. And that comes in hand with Western medications. But an advantage, and don't discount it, is that we know what those good and bad things are, right? So we know what to look for. So that's a great advantage that we have with those medications. People get in themselves in trouble when they try to be the expert themselves and they go to, you know, as we would say, Dr. Google, right? So the advantage to using somebody like me for their pet is I actually have a phone consultation line for people that is worldwide, that people can ask me for advice. Is this something that's appropriate for my pet? Is this a food item that is appropriate for my pet? I do nutritional consults by email and by phone consultation. We evaluate animals. Not that I can diagnose and treat animals outside of my state, but I can almost be kind of that expert to help direct the owner so they don't rely on information that may be presented on Google that someone who is uneducated just put up, right? Because it's unfiltered. Mm-hmm. The second part of your question to deal with, and remind me, was
the tick spray and all of that.
Yes. So again, life is about balance, right? So I say to my owner, let's say you bring your dog to me, and I say, okay, you have a choice, Sal. Your dog can be exposed to fleas and ticks. And fleas are a nuisance, and they can infest your home, and they carry tapeworms, and you know they can transmit disease, and ticks transmit diseases like Lyme disease and such, and that's a risk for you. And on the other hand, you have these applications that are either prescription or not, provided by veterinarians or not, that can help prevent those insects from attaching to your pet and transmitting those diseases. And we know that there are evils that are associated with both the organism and the treatment. My job to be a healthcare provider is to give you the appropriate information so you can make a decision that you're comfortable with for your pet. Some people may say to me, I do never want to see a flea in my house ever in my lifetime of having a pet. Well, if they don't do some sort of treatment, how can I help them to guarantee that? And then I have people say, you know what, I don't care if I'll have fleas, I just don't want a chemical on my pet. So there isn't one easy fit for everyone. I think the job of the healthcare provider is to help the client and or the patient make good medical decisions based on the information that they have. And that's why we're the expert, right?
Right. Okay. Now, could you walk us through your procedure if an animal comes in, whether it's a dog or a cat, with cancer? What are the steps that you take to have a better outcome for these animals?
Well, the first thing is the closer to a solid diagnosis, an accurate diagnosis I can get, the better I can treat any pet with cancer. So we'd like to review the medical records and whatever diagnostic had been done before the animal had seen me. Once I evaluate those past tests and records, then I can make recommendations of what I think might be missing, so I can help fine-tune my diagnosis. Then we address things like diet. We say, okay, well, we know that there are dietary things that we can do to help slow down the growth of cancer, sometimes to shrink or even eliminate tumors. We know that there are foods that will make it worse. So I need to evaluate what they're feeding their pet, and that's step one, right? Mm-hmm. Step two is to make sure that the animal is in a stress-free environment, or as close to one as I can. So we need to make sure that an animal has appropriate sleep, appropriate shelter, and appropriate exercise. Once we do that, then I can say, all right, now we have a diagnosis of ABC, and we've corrected the diet to maintain optimal performance of the animal's body. Now let's see, are there any Western treatments that we can use to help us address this cancer with acceptable side effects? If the client says yes, then we can approach that Western approach and then use our alternative therapies to help mitigate the side effects, which is terrific, right? So if you have a dog that has a cancer and they're on a drug like prednisone that causes increased thirst and urination, well, I may be able to balance that prednisone with an herbal formula and acupuncture to help decrease that thirst and urination. So again, in my opinion, I'm going to present the tools that I have in my very deep, broad, and wide tool chest to my client and say, these are the tools we have to choose from. And I'm going to tell you what the pros and cons of each tool is, and then you're going to help me by giving me the boundaries of how I'm going to treat your pet. What's acceptable for you as an owner? I don't think it's my place to pick and choose what is right for you for your pet. My job is to provide you with the tools and education so you can decide those things for yourself.
Okay, so let's get back to the diet. So what do you recommend that a dog or a cat with cancer starts right away, the foods that they should eat and the foods that they shouldn't eat?
Well, they should not eat simple carbohydrates. Sugar feeds cancer.
Right.
We know that.
Right.
So if you're going to use a carbohydrate source, you have to use a complex carbohydrate. If we're going to use a complex carbohydrate, which sometimes I'll even limit in the cancer patient depending on their presentation when I see them, then it comes down to proportions. You know, a healthy dog is a fundamental carnivore and should probably get about 60 to 70% protein in their diet. And the rest would be balanced carbohydrates with complex carbs, fats, as well as vegetables and fruits. When you get to the cancer pet, well, you need to eliminate the fruits because they have the simple sugars in them, and you need to eliminate the simple carbohydrate grains because they may feed the tumors. And typically, we're going to decrease the amount of basic carbohydrates in the diet as well and support the immune system. So there's things you can add like honey, which help to support the immune system. You know, that's a great additive for dogs that have immune dysfunction and those that have cancer do.
Mm-hmm. Okay, so now, do you feed them raw vegetables? Do you do, like humans do raw vegetable juicing? Do you do any of that?
Well, you need to use wholesome nutrition, right? But we do know that if we think back to our dogs as when they were ancestral and out in the wild, or even dogs of our own that are domesticated, not under our care, what would they be eating, right? So typically they'd be hunting for small animals, rabbits, rodents, and whatever fruits and vegetables they got would have already been almost pre-digested in the stomach contents. Those dogs may also be rummaging through garbage behind restaurants, where a lot of those fruits and vegetables are cooked. So there's not many times that the animal is going to be exposed to a raw fruit or vegetable. And we do know that if you feed your dog a carrot and it's not finely chopped or processed, we're going to see that carrot coming out the other end, right? So we do use the fruits and vegetables. We just need to know how to appropriately give them to that species. So which means that that vegetable would need to be either finely chopped or somehow cooked.
Okay. Now, as far as the water, getting back to the water, if you give your dog or cat clean water, could you add something like lemon to it to raise maybe the pH in the animal?
Well, you can. I just believe, again, that whatever the being might be that created us all, right? However we all got here. The body runs optimally at a pH at about neutral. That's where it runs at the best. If I were to say to anyone that I think I'm smarter than what put us on the planet, it puts me in a very vulnerable position. So I really like to try to keep the body where it's supposed to be, right? Because if you alkalinize the body, at that point you're alkalinizing the urine, and at that point you're increasing the risk of certain types of stone formation in the bladder and the kidneys that don't form at a neutral pH. So you have to be very careful about adjusting pHs of the body, unless you have an abnormality to begin with. So if the body is too acidic by testing, well then of course we should add an alkalinizing agent to make it more alkaline. But I wouldn't say to take a neutral pH body and alkalinize it. I'm not sure in the long run that that's going to become fruitful evidence to us.
Okay.
And that's synonymous to anything. Years ago they said saccharin caused cancer in people, and now they say, well, it only causes cancer in rats. Well, what are they going to say in 10 years from now about saccharin? Mm-hmm. So what are they going to say in 10 years about that? So I really try to bring it back to basics and say, what is the body supposed to be like on this planet? And it's like you said with the fleas and ticks, right? So you have grass in your backyard. All these people panic. I need to have my sprinklers on. I need to have the grass treated. You know what? Grass is going to grow. If we weren't here, there'd be lots of grass. Mm-hmm. So maybe we don't need all those things added to the grass.
Right. Well, most doctors that I interviewed, especially Dr. Robert Young with his pH Miracle, with his book, his best-selling book, they talk about when people have cancer, usually their pH is down. It's supposed to be 7.2, 7.5, and they say it's usually down to about 6. So I would think most doctors, holistic doctors, what they do is they check the pH to see.
Absolutely.
Very easy to check.
Yeah. So if the pH is low, right, then it's absolutely appropriate to increase it.
Right.
Alkalize.
Right.
But if you have a person that has a pH of 7.2, should I kick it up to 8?
Right.
That's where I think you get in trouble.
Right. Most doctors say also, you have that acidic body, and like myself, I'll tell you the truth. Years ago, there used to be all kinds of things you could take for an upset stomach or, so I don't do that anymore. What I do, and it goes away right away, what I do is I take a level teaspoon of baking soda. When I have like acid reflux, now and then if I ate too much, too late, I get that. And I take a level teaspoon of baking soda with water, and within, I'd say, a minute, it's gone and neutralizes the acid in the stomach, which I want to try and avoid, having an acidic body,
So we have to back up one step before that. So what we have to figure out is, what did you put in your body before that caused the acidic stomach, right?
Right. Hmm.
So we know that meat is acidifying. So people who eat too much meat, it's not surprising why they are more likely to get cancer, because it's going to drop their pH.
Right.
So why can't we just fix it with diet? Why do we have to add a supplement? Why can't we take that pet and make sure that they're eating the appropriate proteins so not to change the pH of the body dramatically?
Right.
So you don't have to give them the bicarb.
Right. Well,
Right?
with me, I'm glad you brought that up because I haven't eaten meat for years. It's got to be 25 years. A hamburger, nothing. You know, I believe, and I have believed for many years, that it's not good for you. And I had Ed Griffin, which was on my show, and he explained what's in the meat is why it could cause you cancer, right? I forget offhand what he said, but I was always a believer. And you know, nowadays, you never know whether you're eating a diseased animal or not. You know,
Well,
I
I
mean,
can only speak on behalf of the animal community, right? Because I'm not a licensed MD. And, you know, we are not obligate or fundamental carnivores like our cats and dogs. We're omnivores. So our diet is typically more balanced, like 30%, 30%, 30%, right? So our protein intake is about 30%-ish, right? And, you know, we are more likely to choose things that we want to eat, whereas our pets are not. The pet's body metabolizes food differently than our bodies do, but the foods still have inherent actions. So if you fed a dog just straight beef for its whole life from a contaminated source, you're going to run into very similar problems that you would have in that person that just ate beef. So again, you have to remember how important variety is.
right,
Right? We need to change what we feed, what we fuel the bodies with.
right.
The
Okay,
second is my industry is the industry that's responsible to make sure that that cow's healthy, that you ate.
right. But unfortunately, the way it seems to me, there's not enough people that go around and check every animal that goes that goes to market, and that's unfortunate because you don't know what you're eating really, especially if it comes from another country. You know.
And that brings me to the point of, can we be purists or do we have to be realists? So I'm more of the philosophy that let's be realist and not a purist, because being a purist is virtually impossible based on what you just said. We don't know.
Right.
So what we have to do is put our pets in the best position we can medically and health-wise so they can handle insults that they're going to come across.
Okay. Now let's get to supplements.
Yes.
What type of supplements do you give your cancer patients?
Well, Western medicine loves to pick out an active ingredient. So they love to say that this one specific chemical is going to give you XYZ answers and such side effects, right? Chinese medicine works a little bit differently because we're trying to really tonify and bring the body back into balance. So a supplemental package or an herbal therapy that I might use on one dog with cancer could be very different than a supplemental package I use on a different dog with cancer, because it depends how the body has presented itself to us.
Okay, can you give us an example on what supplements you use for different animals?
Well, we use formulations of herbs. So when Chinese herbal formulas are made, they're typically herbs that are brought together to help work synergistically with each other, as well as to help mitigate side effects. So, for example, most animals that have cancer I know are going to have a weakened immune system. So I'll put them on a Chinese herbal formula called Wei Qi Booster, which is designed to help inhibit cell mutation and tumor growth, as well as to build up the defenses of the body so it can pick off these cells. But a dog with cancer could come to me with a liver yin deficiency, whereas a different dog with cancer could have a kidney qi deficiency. Well, that formulation of supplements is going to be completely different for both animals. In my opinion, there's no silver bullet. When Dr. Oz goes on TV and he says, goji berries are going to fix X, Y, and Z for everyone, I have a problem in my philosophy believing that if everyone goes out and runs and eats goji berries, it's going to have the same effect on everybody.
Mhm.
And that's just being a realist and not a purist.
Right. Now, what about turmeric? Do you give?
I think turmeric is a great Western herb. Again, it's a single compound, right? So the Western world loves to do that. But turmeric in Chinese medicine is combined in formulas sometimes to help break up stagnation. So we use it a lot, not only for cancer, but it's put in formulas for pain management as well.
Right, arthritis, all of that. I use it myself every day. And believe it or not, I'm very bullish on turmeric. I say this almost every show because I want people to know about turmeric. That is the #1 supplement that's more sought after than any other supplement. So to tell you a little bit about what I believe with turmeric, what I've seen with turmeric is that a family member had colon polyps for about 20 years. And every year we'd go back and back and back for a colonoscopy. And there'd always be anywhere from 3 to 15 to 18 polyps. Some the precancerous, some not precancerous. So when I started to do my research on alternative medicine and treatment and all of that, I came across turmeric and I found doctors talking about polyps, how it gets rid of polyps. So I said, why don't you're going to have to start taking this turmeric and see if it works. They took it for a whole year. And at the end of the year, went back for a colonoscopy. For the first time after so many years, there was no polyps, there was nothing, So doctors are saying, MDs out there, that turmeric is a very good product for polyps, no matter whether they're in the colon or they're other places in your body. So,
right. And as well as turmeric, I don't know if you're familiar with Ostrea, but Ostrea is an herb that's used to help soften nodules. So what I'm trying to say is, why just stop at turmeric?
No, I agree.
Right. I mean, there's so many things that we can do. There's Sparganium that we can use that helps to purge the interior in Chinese medicine. There's Filaria that's used to help soften the hardness of masses. There's all these anti-stagnation herbals and supplements that we can use. And I guess being holistic, I say to myself, don't be so Western. Don't focus just on one. Maybe if we put them together, they'd even work better. And, create a more natural environment in the world. When animals would go out or people would forage, they accidentally came across turmeric. But it's not all that they ate. They mixed it with other things in their diet to help treat them. So, again, I think that's great advice. I think for pets that turmeric has a definite place. But I think that you can use it in conjunction with other herbals and supplements to help your effects be greater. Right. But what I'm so afraid of is when you say turmeric, not everyone should have turmeric. Now, if you have polyps, you should take turmeric. If you have arthritis, you should take turmeric. But I get this fear of people just running out for these, what they suppose are these miracle cure supplements, and they don't have an issue that has led them to take it.
Well, everybody, especially at my age, has issues. Trust me. Everybody has issues. There's so many things that turmeric does. It's amazing. You look at WebMD, you look at any one of these research channels, and you'll see it's good for complexion. It's good for a lot of things. And it's good for like a cancer maybe that is starting to develop, in my opinion. Not only do I take turmeric, I take triple strength turmeric with pepperine in it. The pepperine is very important because it helps it to go more into the blood than into the gut. But I take 25, 30 supplements a day. I don't take them all at once. Maybe I take half and I take half. But you want to know something? I don't take any flu shots. I don't take anything. I don't have to take anything because this really, what I'm taking pumps up my immune system where I don't get sick. And I'm a big believer, especially at my age, because there's a lot of things at my age your body stops developing as much, like glutathione. That's another thing that I take myself that helps me, I believe, in being healthy and staying healthy, you know.
You want to know what I think the biggest asset to animal health is compared to human health?
What's that?
We offer our animals fresh water ad lib and only water to drink. The biggest deficiency that we have in people is adequate water intake.
You're right.
If you drank more water, you'd have nice glowing skin.
Right.
If you drank more water, your blood would be thinner so it could flow and you'd have less stagnation. So, you know, what we don't want to happen is I don't want to see your countertop filled up with 35 supplements. I would want you to make sure that your pet eats healthy. It eats a balanced, wholesome, nutritional diet. And hopefully with the nutrients that are provided to help build up the immune system so I don't have to add processed supplements to the diet. Clean, fresh water from the cleanest source we can get, right? If you give those things, if you eat a healthy diet and drink clean water and you exercise and you sleep well and you play hard and you work hard and you keep your life in balance, you're going to be healthy. Everything in moderation, right? So my whole viewpoint is let's get back to basics and be simple.
So
right?
What is a good diet? You mentioned diet a few times. What is a good diet? How many times you think a day a dog or cat should eat? Because sometimes with, especially cats, you see people go to work and they leave a whole bunch of food.
Right.
You know, so this way if they get hungry in the day, they're going to eat.
Right.
Now, is that a good thing or bad thing?
That's a bad thing. You know, people, Americans specifically, we love convenience, right? We love inexpensive and we love convenience. And dry kibble dog food, when it was first introduced on the market, was made in World War II for the service dogs. And the reason it was made was because they needed a light product that had a good shelf life, that was inexpensive to feed these dogs while they were in Europe. It was never designed to be a long-term maintenance diet. But for the population in our country, it's convenient. They buy a bag, they're convinced that it's a complete diet, it's inexpensive, they can leave it on their shelf, right? And they're told that they can feed the dog once a day. Well, mammals are mammals. You know, they tell people you should eat 3 to 5 meals a day and almost be like grazing. Well, there's no difference for our dogs and cats. If your dog was outside, it would eat when it was hungry. It would go find a rabbit, or it would go through the garbage when it's hungry. It wouldn't wait and say, oh, it's breakfast time, it's 8 a.m., I'm going to eat as much as I can gorge myself with and then move on. So I think common sense dictates, and we have to keep going back to that common sense, right? So if you're in a veterinarian's office and the veterinarian says, here's a bag of dog food, and I think that this one food is going to be good for your dog for every meal for the rest of its life, and you only have to feed it once a day, and it can sit on the shelf for 3 months, if you can leave that office with that bag of dog food in good conscience, believing everything you were told, well, God bless, right? But I would question that. I would say to myself, how is that possible? And if it was possible, why don't they have it for me? Why can't I find one thing that I can eat all the time to make sure that I'm going to be in the perfect health for my entire life? And I only have to eat it once a day, and I'm not going to be hungry. It's crazy. It's not realistic.
Right.
So I think people should feed their dogs and cats 3 to 5 times a day, small meals frequently, and they need to feed diets that are biologically appropriate and balanced.
Okay.
But there's not an easy answer. Every animal has to be addressed, and that's why it's so important that I have this service available to people to be able to come to me for a nutritional consultation. Once they see what I can give them, I hope that they go to their veterinarian and say, well, why can't you give me this? Mm-hmm. I'm not so special. I have the same education that all these other doctors have. The Chinese is obviously extra. There's no reason they can't get it. Mm-hmm. They can get the education too.
Right.
Western medicine's only been around for 200 to 300 years. Chinese medicine's been around for 3,000 years, which is the traditional.
Mm-hmm. Right. You're right.
Right?
Yeah.
So I think that we got to get people to start to think for themselves again. Mm-hmm. Stop just listening to what's told you and use your instinct. How does that sit in your stomach, what they told you? Do you agree with that? If you do, you should be with that doctor. If you don't, you need to run and find a new one.
Right. Okay, so what about detox for an animal with cancer? When you're trying to get rid of the cancer. Now, do you do detox also?
No.
You don't? Okay. Now, then what about stress? How do you treat stress in animals?
Well, we try to teach the owner, we have to find the source of the stress, right? So to be able to treat stress, you need to find out where it's coming from. If it's a family issue, then we have to try to educate the owner of the pet to help find the sources they need to help fix where that root is grounded. If the animal is stressed because of a health condition, well, it's my job to bring that animal back into balance. And if I can bring that animal closer to balance, I'll restore health and reduce the stress. So I can use tools like acupuncture, and I can use tools like Tui Na, which is Chinese medical massage. It's kind of a cross between chiropractic care and therapeutic massage. But I have patients that come in that are very wound up. They're very stressed at just being in the environment of being dragged out of their house, brought into a doctor's office. And the minute that I lay my hands on them and perform some minor, even Tui Na procedures, you can sense the animal releasing that stress and tension.
Right.
Now, then I bring it back to the beginning. I said to you, my owners are an extension of me, and they're the nurses, right?
Mm-hmm. Yep.
So now I teach the owner how to do Tui Na at home. Mm-hmm. Okay. So we can help that less stressed life.
Now, in all the years that you're practicing, have you come across many dogs or cats that were in perfect health, no matter what their age was? And I'm sure you give a questionnaire out for the owner to fill out, right? What have you found that these animals did different, if any, to live a long and healthier life?
Well, nobody's perfect, right? And no animals are perfect. So it's not common for me to find that animal that I say, you know what, we don't have to do anything. But I will tell you that the animals that present the healthiest and the most balanced are the ones that are fed that wholesome nutrition, biologically appropriate, balanced diet. Those animals that are exercised adequately. Those animals that have good shelter and have the ability to sleep soundly. And those animals that are given tasks. If you have a working dog, you need to give them a job, or they're going to be out that stressed out animal. You have so many people, you say these pit bulls are all in the shelters. And you wonder why pit bulls are all in the shelters. And my argument is that these animals need a tremendous amount of exercise. So you get a person who says, oh my God, I'm going to save the cute little pit bull in the shelter, and I bring it home. And if they don't provide the appropriate exercise with the animal, then the animal gets stressed and the animal gets destructive. Then all of a sudden, the animal's brought back to the shelter.
Okay.
So stress can even lead to how you're dealing with breed-specific issues in your dogs.
Can we talk a little bit, we have a little time left, about your book?
Yes.
And what you're trying to convey to the readers of your book?
Well, firstly, I want people to try to open their minds and say there may be other available philosophies in treatment and health care that they may not be using. I want people to be able to incorporate the strengths and weaknesses of both worlds, the Chinese world of medicine as well as the Western world of medicine, and be able to combine them to help mitigate a better treatment plan than we would have had without them. I also want people to look at things in light of common sense. You know, you talk about spay and neuter in dogs and cats. The reason the spay and neuter program came to be was because we had all these animals overpopulating areas and, you know, God forbid, getting hit by cars and trucks, loading up shelters, getting killed, all this stuff. In my area, you know, when I have a patient come to me, again, I try to educate the patient to make a good choice. Right now, where my practice is, we don't have a lot of stray animals because a lot of these animals are carried around and treated like children. So now I say to myself, well, why are we spaying or neutering this animal if it's not in a situation where it's going to be an issue to the community? Then I say to myself, you know, I look at my daughter and I say, what if the pediatrician said to me, I want you to remove your daughter's ovaries before she goes into puberty? Now, I challenge you to find a medical doctor that would say that that's a healthy thing for that child. So it's not that I don't believe in spay and neuter, but maybe we should wait and spay and neuter them when they're fully grown and they have all the use of the hormones. Maybe we shouldn't do it at 3 months of age or at 6 months of age. So these are the type of things, besides nutrition and teaching people a little bit about how Chinese medicine works, that my book really delves into. It's designed to show people the best of both worlds and how we can come together. And if we took that philosophy even beyond medicine, we might have a peaceful planet.
Mm-hmm. And where could someone pick that up? Is it on Amazon? And
yeah, so it will be on Amazon. They'll be able to go to Amazon and buy a copy of the book. It should be out within the next month. So we're very excited about the release.
And the name of the book?
Is going to be, it's an integrative guide using the best of both worlds to make your pups healthier.
Okay. Now, is there anything you want to add before we close that we didn't mention?
Well, I want to let everybody know that I'm really available. If you have a question about how your pet's health care is being addressed, I am an email or a phone call away. You can simply go to my website at thecaringvet.com and ask. And we can help direct you to make sure that you're getting the health care that your pet deserves.
Okay. And do you want to leave a phone number? And what was your email address?
The email address is thecaringvet@gmail.com. The website is thecaringvet.com. And my phone number is 631-367-7387, which spells out FORPETS, for pets.
Very, very, very good. Okay, so now we have all of that, and you're in Huntington, New York, Huntington
Yes.
Station, New York, and there's a lot of animals down that way, that's for sure. I used to live not far from there.
Yeah, and everyone can find me on Facebook as well as The Caring Vet. So look me up on Facebook. Let's become Facebook friends, and hopefully we can help all the animals.
Thank you so much for joining me on the Health Show. You are very informative, and people should go out and buy his book when it comes out in a few weeks. I'm sure that's going to be very informative also.
Well, hopefully, Sal, you'll have me back on. I'll be able to show it to you, but people will be able to find it on my Facebook page as well.
Absolutely. We'll have you back again.
All right. Thanks, Sal.
Thank you. So there you have it. Go to his website. Give him a call if you have any questions. So I want to thank you for being on the Health Show, viewing us on the Health Show, and I look forward to seeing you again the next time. Thank you.